Good afternoon and aloha. Today I wanted to talk about two things. One is testing, the other one is how do we unthaw our stay-at-home order and open up. So first on testing. Testing is the key to opening up. It's the most critical component of opening up. It's how the government protects the public from the spread of COVID-19. And this testing has to be aggressive, it has to be repeated, and it has to be done often. It has to be contact tracing, following where the positives are and testing those who they came in contact with and isolating those who test positive. No forward-thinking mayor or governor anywhere around our country disputes this fact about more aggressive, rapid testing. The great universities of our country support such aggressive action. And the City and County of Honolulu, in fact, is using the Johns Hopkins Public School of Health model with input from the Harvard study on testing thresholds. On our own University of Hawaii, about a week ago, in a recent study, advocated strongly for aggressive testing, contact tracing, and isolation. In addition, the Public Health Recovery Task Force testing working group, led by Dr. Mugi Ishii of HMSA, has said we need to step up testing. And in fact, the House committee who put this group together stands behind the efforts being led by Dr. Mugi Ishii. And what does Dr. Mugi Ishii say? More testing that's being done today, both symptomatic and asymptomatic, all healthcare workers, all first responders. And they need to reevaluate Hawaii's test criteria as you go forward, both nationally and internationally. What are the best practices in our country and around the world? And we're all learning together and all sharing information. The City and County of Honolulu supports all these efforts and more, and wants to work with those who will lead forward. That's why we went with the Everlywell company. They have a turnkey operation. The City and County of Honolulu does not have a Department of Health, and we'd have to build a turnkey operation, and they could provide it. The city did its due diligence. Despite initial claims by the Department of Health that one, Everlywell's tests were illegal in the United States, and two, that the Everlywell lab was not certified by the FDA, have not proven correct. Upon further discussion, DOH has backed away from these two claims. But they have raised other issues regarding lab tests, turnaround time, and proper reporting of results. And both of these concerns are valid and ones that we want to follow up on with Everlywell to get them resolved. And we appreciate the Department of Health bringing these to our attention. At this point, I would like to call up our Managing Director, Roy Amamiya, who had a meeting with Dr. Bruce Anderson yesterday to discuss this issue further. Thank you.
Thank you, Mayor. Yes, we did have a meeting yesterday. It included Dr. Bruce Anderson, Dr. Sarah Park, Dr. Elizabeth McNeil, Dr. Robert Hirokawa from who represents the community health centers, as well as some of us from the city. And it was a positive meeting. It's positive in the sense that the regrettable letter that the Department of Health sent out on the 22nd, since that time, they've had a chance to talk to a couple of the chief medical officers at Everlywell, and now they understand that the test is both legal as well as the labs that they are using are CLIA compliant. And so basically they are very supportive of the fact that the city continues to test, and even more so that we're wanting to work with the community health centers. You know, there are 13 community health centers around the state, and they service clientele oftentimes who can't access medical, traditional medical facilities or doctors. And there are about 96,000 of them around the state. And many of the people who go to these health centers live in public housing or in crowded conditions. And so we really need to make sure that they get tested like the rest of us. What was very positive about the meeting is that the Department of Health acknowledged that the strategy of trying to reach out to these community health centers is a very good one that they support. And also that increased testing is something that needs to occur. It's something that we don't think we heard in the past. And so from that standpoint, we left the meeting very pleased with what was discussed. I guess that's about it, Mayor.
No, I do want to thank Roy, and I also want to thank Dr. Anderson and his entire team for sitting down with us. You know, this is something that I think is important. We all want to be on the same page, and we all want to move forward. We want to protect our community, and we want to be able to open up in a way that we protect the community every single day as we loosen up and thaw our shutdown. So until we resolve the concerns with Everlywell, which we're continuing to work on in terms of the, I call them customer service types of things, turn around and how reporting is done, and we want to make sure it follows HIPAA and that all requirements and laws are complied with. We're going to be pursuing other testing opportunities. We're not going to back away. We want to continue to see how can we ramp up testing even more. And if at all possible, we want to work with local labs and local facilities and institutions, including the Public Health Recovery Task Force testing working group that we talked about. They've asked the city to participate along with others, and we're going to be there. Our first conference call is today at 5:30. And, you know, once we start working on other options, including the Everlywell one, we'll have more to announce in the very close future. So the second topic I wanted to talk about was opening up, which we've done now for about a week, maybe a week and a half. Because time is of the essence. It is the key to thawing out of our stay-at-home order. And we need to be aggressive about testing. We need to be repeatedly testing. We need to contact trace, and we need to isolate all along the way as we open up our economy, every step of the way. That's how we protect our community and the residents and their health. And it starts with the Johns Hopkins 4-part environmental report that we talked about last week, environment report, or we call it a form of a weather report. And there's also then a risk assessment that it kicks in. And I want to talk again just to repeat what the weather report involves. Number one is epidemiology. That's the testing part. That's the contact tracing part. That's the isolation part. But the other two components deal with our healthcare system and our public health system. As we continue to open up, we manage to see what kind of cases are there, and at any time if we impact in a negative way either our healthcare system or public health system, we slow down, we back off maybe until we see the weather getting better. And the last one, the fourth one, is social readiness. And that is, how are we doing? Are we all wearing our masks? Are we practicing good physical distancing? Are we complying with all the orders? So that's the weather report. The other part is the risk assessment. There's low risk with modifications. There's medium risk with modifications. There's high risk with modifications. And there's high risk that you can't do any modifications. And perhaps those kinds of things will not occur until there's a vaccine. So, you know, last Saturday, we opened up all the city parks for exercise. Very low risk with minor modifications. Just wearing facial coverings, practicing social distancing, facial coverings where possible. If you're jogging hard, you probably don't want to wear a facial covering. You know, and it went pretty darn well. You know, people really welcomed the opportunity to get back into our parks for exercise. We saw it all around the island, and it brought a smile to my face, and I'm sure many others. And HPD said it went well, too. There were a few warnings and citations. You know, we saw some who gathered when they shouldn't have in larger groups. And we saw some who weren't wearing face coverings when maybe they should have. But for the most part, there was compliance. But the environmental report remained sunny overall. The number of cases remained very low, including for Oahu. And therefore, all four categories at this time are being met and addressed. So as a result, here's some of the things we've been talking about. We talked about it last week on both Tuesday and Thursday. We've talked about it in other public settings. We're going to continue to talk about it with the mayor and the governor, mayors and the governor, because we want to share what we're doing. And the city and county of Honolulu has shared all along the way, including our stay-at-home work-at-home order was submitted prior to actually our implementing that order. We believe that that's the best practice, to get input from each other and to make it better and to learn. And so the kind of things we're talking about are low-risk categories with modifications. And as we talked last week, I just wanted to get into a little bit more detail, or for example, things like automated services providers, such as automated car washes that are consistent with CDC guidelines. So there's no interface really between a customer and the provider of the service. It's all automated. Car washes. Number 2 is mobile service providers, which provide services on a mobile basis where there is no interaction between the service provider and the customer, such as pet grooming with, again, compliance under CDC guidelines, where someone may come by the house, do grooming with your pet, but you don't have interaction. A third one would be services provided on a one-on-one basis, such as private tutoring for music or math or other things like that, where there's just the teacher and the student in a room, they're practicing good physical distancing, they're wearing face coverings, and they're learning. And again, this is consistent with CDC guidelines. And then on car dealerships, both new and used car dealerships operating on an appointment-only basis with social distancing requirements and no test driving with a sales agent. So you'd be just driving by yourself, testing the vehicle if that's permitted. Number 5 is certain real estate services that must be accomplished by remote and electronic means wherever possible, including appointment-only open houses of no more than 3 people at any given time with appropriate social distancing. So we loosen up a little bit there. And number 6, public and private golf courses, but under appropriate social distancing and sanitation hygiene guidelines of the Professional Golfers Association, quote, procedures for reintroduction to the game and business of golf. It's very detailed, 3-page, dense recommendations. So in conclusion, as we continue to open up, following our environment report, our weather report, as long as it remains sunny and we don't see any storm clouds on the horizon, which testing will provide, we'll start opening up the least risky types of businesses with modifications, such as the one we just opened up last Saturday, exercising in parks, and moving up the ladder of greater risk with modifications as appropriate, and with aggressive testing, contact tracing, and isolation, continuing at every single level to protect the public health of our community and hold down the curve, which all of you on the island of Oahu have been working so hard to do, and you see the results of your efforts. With that, I would open up to any questions you may have.
Mayor, this first question is from the Star Advertiser. Did you get prior approval from Governor Ige for today's announcements, given the governor's announcement this past weekend on approval process before announcing any new virus-related policies?
So the governor's, actually is an order he entered, requires that the mayors get approval before amending their orders to open up different levels of business, and we're complying with that. In fact, we continue to talk, both the mayors and the governor, on a regular basis of the kind of things we want to open up, including as we saw yesterday on the florist discussion. So we continue to talk, and today is about the kind of things we're looking at. And I think it's appropriate to share with the public and the business community the kind of things we're looking at to get input from them. Of course, no action will be taken without the authority of the governor.
This next question is from Annalisa Burgos at KITV. She's asking for a detailed plan on getting the testing kits to the community health centers.
So under the turnkey Everlywell plan, the test kits would have been delivered by UPS, and the test, after it being taken, would be picked up by UPS and delivered to a lab where the analysis would happen, and then the reporting would be given. That was the beauty of the Everlywell test. It was turnkey. The city and county, while paying for it, did not have to actually pick up or deliver or take. We wouldn't be able to do that. So that's why we remain interested in trying to resolve these customer service type issues, to see if perhaps in the interim we could go forward with this test. At the same time, we are reaching out to other institutions and providers to see if perhaps we could use the labs that are here and working with others. But the issue will be, how do we get the tests delivered to the community health centers, because we want to work with them, and how do we pick them up? And it's not within our wheelhouse for the city and county of Honolulu to do that. But we're looking for ways to do it, because we believe that aggressive testing in communities of need are extremely important.
This next question is from Chelsea Davis at Hawaii News Now. Many local small business owners in the beauty industry, like hair salons and barber shops, are asking to reopen on May 1st with limitations. Many salons in other states have reopened, allowing less than 10 people in the shop and requiring employees and customers to wear masks. Is this something you are willing to allow?
So as you heard my discussion, I described 5 or 6 types of businesses I think we could reopen. What do you call it? Hair salons, beauty shops, those kind of barbers was not on that list. And part of the reason is the risk factor is much higher, and the modifications are a little more difficult. But it's something that needs to be addressed. But I don't think it occurs early. It occurs a little further on. As much as it breaks my heart, you know, the Honolulu Star Advertiser, they had a detailed article about this very issue and people struggling. I am a little concerned about some of the states that have opened these southern states that have governors that feel, let's just open up everything, is a very high risk. But if you can assure that a customer is protected and that the employee is protected from each other and still perform the service of cutting hair or whatever else they do, I think that's something we should look at. And again, those are the modifications. And I'm really interested to see what the governor and other mayors will think about this, and looking at other best practices. But I think some of the practices implemented by some of these southern states are dangerous.
Sticking with Hawaii News Now, this next question is from Daryl Huff. What is the likelihood you will still use Everlywell given the new information that local testing is available at a lower cost?
No, one, I'm not sure whether it's a lower cost. I was given a number of 110 for the local versus 100 from Everlywell. But to answer the bottom line question, Everlywell is not off the table. We continue to look at them as an interim provider should we address the customer service issues, while we also look at other local labs. And if we can get it for the proper cost and a sufficient number, part of it is, you know, what is the supply like? Because we wanted to initially purchase 10,000 tests if it's available, and that we can get them out to the community health centers. Of course, we'd work with the local folks too.
And Brenton Owa from KITV asks, when can all of the businesses that you mentioned reopen?
Well, if it was, if I had the authority, I would probably like to see this happen by May 1st, which is coming up very shortly. Because I think the risks are low, and I think the modifications are appropriate for protecting the customers and the employees.
And Max Rodriguez at KHON asks, is there a timeline for when first less risky businesses could begin to open? How about non-emergency medical practices like dentists, when these services begin for non-emergency appointments?
So I think we've described the first phase of trying to open up some businesses, and I think there would be other decisions made in the future. It's hard to pick a date. You know, some people say, let's on Memorial Day open up, let's on Kamehameha Day open up, or 4th of July. You know, we're predicting weather, which is those 4 criteria, of which testing is a big one, and you can't predict a month out. It's where you are within a short period of time that allows you to take those next steps. But on non-essential type of healthcare decisions, I think we heard the governor yesterday talking about exactly that, and I thought his decision seemed rational and well thought out.